Now we go to the muscles of the antebrachium. We will start with the muscle that located on the craniolateral surface of the antebrachium. These are the extensors. And after that, we're going to go to the muscle that located on the mediocaudal aspect of the antebrachium, and those mainly the flexors. Some of these muscles, they cross the elbow joint, the carpus joint, and the digital joint. Their main action will going to be on the carpal joint and on the digital joint. Remember, we said that any muscle that crosses more than one joint, it will exert its maximum action on the most distal joint. So even the muscles that originate from the humerus, lateral epicondyle or the humerus medial epicondyle, they have very little action on the elbow joint. So their main action is on the carpal joint and on the digital joint. So starting with the extensor, the first one is the Extensor Carberedialis, which is this muscle here. The Extensor Carberedialis, it is sitting on the cranial surface of the antebrachium. Okay? This muscle you can easily palpate in the live animal. It originates from the lateral epicondyle of the humerus, which means it crosses the elbow joint, but it has very minimal action on the elbow joint. So we don't even stress on that or mention that. Now, the Extensor Carberedialis. Okay, if you look at the name, it is an extensor of the carpus, and it is sitting on the cranial aspect of the radius. That's why the name Extensor Carberedialis. If you go and look at the insertion of the Extensor Carberedialis, the Extensor Carberedialis go over the dorsal surface of the carpal joint and insert with two tendons, one to the second metacarpal and another one to the third metacarpal. Okay? It doesn't go beyond the carpus. So this muscle mainly acts only on the carpal joint. It is extensor of the carpus because when it contracts, it will increase the flexion angle of the carpal joint. Now, lateral to that, this muscle here also originates from the lateral epicondyle of the humerus. This is the common digital extensor. The common digital extensor, it has tendon that insert on digit number 2, 3, 4, and 5. That's why the name common digital extensor. Okay? It extends the digits, also it extends the carpal joint because it crosses the carpus joint. Its main action is on the digit. It is an extensor of the carpus and it is an extensor of the digits. Extensor Carberedialis is only extend the carpal joint because it is insert on the metacarpal 2 and 3. It doesn't go beyond that, so it has no effect or whatsoever on the digital joint. The common digital extensor, on the other hand, because it go and insert on the extensor process of digit number 2, 3, 4, and 5. That's why it is an extensor of the carpal joint and also it is an extensor of the digits. Now, this small muscle here, this is the lateral digital extensor, and the lateral digital extensor crosses the carpal joint and go and insert on the dorsal aspect of digit 3, 4, and 5. So it's an extensor of the carpus and an extensor of the digits as well. This big muscle here, okay, this is the Ulnaris lateralis. And the Ulnaris lateralis also originate from the lateral epicondyle, and it insert on the lateral side of the fifth metacarpus and the accessory carpal bone. So although it is located with the extensor, but actually its action is to flex the carpal joint. Okay, Ulnaris lateralis, it doesn't go to the digits, it will insert on the lateral surface of the metacarpal 5 and to the accessory carpal bone on the palmar aspect of the carpus here. That's why when this muscle contracts, it flexes the carpus joint and also it stabilizes the joint. So, extensor carberedialis, common digital extensor, lateral digital extensor, and Ulnaris lateralis. Now, if we reflect the extensor carberedialis and we retract the common digital extensor, we will see this muscle here. Okay? This is abductor digit 1 longus, and this muscle has one tendon that go to the dew claw. Okay? It will abduct the dew claw. Okay? That's why the name abductor digit 1 longus or abductor pollicis longus. Okay? Now, also if you come to the proximal aspect here, attached to the bone in between the extensor carberedialis and the common digital extensor is the supinator muscle. And this is the muscle that's responsible for supination. Okay? Supination in dogs is not a major activity. It's very limited in dogs, although the supination in cats is very extensive. So supination and pronation in the dog is limited to a certain degree. In cats, they have more stronger supinator and pronator muscles. Okay? This in regard to the extensors. Okay? When you go to the caudal aspect, okay, the first muscle here, this is the Flexor Carberedialis. This muscle has two parts. It has an ulnar part, which is coming from the caudal aspect of the olecranon here, and it has a humeral part, which is coming from the humerus. So this is the Flexor Carberedialis ulnar head. Okay. This is the Flexor Carberedialis humeral head. Humeral head because it originates from the medial epicondyle of the humerus. These muscles with these two bellies, they go and insert on the accessory carpal bone, so it's the flexor of the carpal joint. It does not extend beyond the carpus, so it has no effect on the digits. Okay? When we go fix this here. Okay. Okay. So this is the Flexor Carberedialis. This is the ulnar head, and this is the humeral head. This is the superficial digital flexor. The superficial digital flexor, because it is sitting superficially, it is coming from the medial epicondyle of the humerus. It go and insert on the middle phalanx, on P2. So it flexes the carpal joint and also it flexes the digit. This is the superficial digital flexor. Going cranial to that on the medial side, okay, this is the Flexor Carberedialis. Okay, it is flexing the carpus. Okay, it is attached to the radius. It has nothing to do with the digit because it doesn't extend to that level. After that, this is the pronator teres, and the pronator teres, it is the muscle that is responsible for pronation. Let me expose it more here. Okay, this is the pronator teres, and this is the muscle that is responsible for pronation. So the pronator is on the medial side, the supinator is on the lateral side. So again, from the start, these are the flexor, carpi ulnaris, ulnar head and femoral head, superficial digital flexor, flexor carberedialis, and pronator teres. This one here, it is the extensor carberedialis on the cranial side. Now, okay, if we move the superficial digital flexor and we go deeper, okay, let us move. Okay. This is the deep digital flexor. The deep digital flexor in the forelimb, it has 3 heads. One head and the larger head that consists of like 4 or 5 bellies. This is the humeral head of the deep digital flexor, all this. Because it is coming from the humerus, that's why it is the humeral head. Okay? If we go to the radius, the cranial aspect, just distal to the pronator teres, you will see the radial head of the deep digital flexor. When we go to the caudal aspect of the ulnar, okay, this part here, this is the ulnar head of the deep digital flexor, and all 3 heads of the deep digital flexor, humeral, ulnar, and radial, they go and insert on the distal phalanx at the palmar surface. This deep digital flexor muscle, they will flex the carpal joint, and also they will flex the digital joint.